Good morning, everyone, and thank you for joining us for day 2 of the workshop, U.S. Healthcare Expenditures, Costs, Lessons, and Opportunities, being held by the National Academies Roundtable on Population Health Improvement. I'm Sarah Gollist, an Associate Professor in the Division of Health Policy and Management at the University of Minnesota School of Public Health. And I am really delighted to get to moderate this panel today on framing and shifting the narrative on health. But before I do that, I want to provide some brief highlights from yesterday's excellent panel sessions. So we learned yesterday that approximately 30% of healthcare spending, that is spending on medical or clinical services, may be considered waste. In other words, it's spending that does not improve health. One estimate we heard cited yesterday is that spending on this non-value-added healthcare accounts for $879 billion. And these wasteful healthcare expenditures create opportunity costs. In other words, those resources could have been invested in the social determinants of health or the many programs outside of healthcare that contribute to health, like universal pre-K or housing supports or nurse home visiting. Many panelists also noted yesterday that COVID-19 has highlighted our connectedness and some of the elements needed to build a better, more upstream infrastructure to promote health and health equity. We also learned about several models and approaches that show how we can lower cost, improve quality, and improve health. For example, the Milbank Memorial Fund launched an initiative for sustainable healthcare costs to advance and support state efforts to address healthcare costs. Delaware adapted a Massachusetts program that aims to improve health for special populations with an established framework and process to define quality benchmarks to reach annual targets for healthcare costs. We also learned about a partnership led by the United Way of Greater Cleveland, which implemented the CAPG model designed to help multi-stakeholder coalitions invest collaboratively to respond to social and healthcare needs in an integrated way. And last, we learned the role of the Center for Medicare and Medicaid Innovation, or CMMI, which designs, implements, and tests new healthcare payment models to address rising costs, quality of care, and inefficient spending. CMMI focuses on community transformation and incentives for patients and providers. Models within the Innovation Center portfolio include the Accountable Health Communities model, the Community Health Access and Rural Transformation model, and the Geographic Direct Contracting, or GEO model. Finally, and most relevant for today's discussion, we learned yesterday about some important barriers to and facilitators of this needed shift toward investing in health and health equity. For instance, speakers yesterday highlighted the need for bold and innovative leadership, along with governance strategies to support leadership. Evidence to identify which services or programs are of lower value and which are of higher value. Importantly, we need the political will to be bold and align public policy incentives toward those strategies that will improve population health. And finally, and importantly, we learned about the importance of communicating transparently with the public about costs and trade-offs so we can achieve a shared understanding of the problem and need for solutions. So that's a really excellent segue to our panelists this morning, who will all draw from their considerable research and experiences to help us better understand about how we can achieve that shared understanding of the problem, solutions, and building political will to get there. I will now briefly introduce our 4 panelists, but I want to make sure that you go to the attendee packet online for their complete bio sketches. So today we have Dr. Venice Haynes, Director of Research and Community Engagement at United States of Care. We'll also hear from Dr. Eric Schneider, Senior Vice President for Policy and Research at the Commonwealth Fund. Dr. Julie Sweetland is Senior Advisor at the Frameworks Institute. And last, we'll hear from Dr. David K. Jones, Associate Professor in the Department of Health Law, Policy, and Management at Boston University School of Public Health. Now, before we get started with remarks from these excellent panelists, we actually want to learn more about the opinions of all of you watching this live stream. We know you've come to this session because you care about healthcare, about policy, and about improving population health. And now we want to learn from you what you think are the most important issues. So we are going to have a poll for you right now. So if you scroll down just below the live stream window and you click on the polls tab, you'll see the poll that we are asking you to respond to today. All right, so it should be up there. And the question is, if you had to choose, which would you pick as the most important health policy issue facing the United States today? So please take a moment to complete the poll. I know that these choices are probably not inclusive of all the many other issues that are important to you, and we hope to get to them in the discussion. So with that in mind, as you're filling out the poll, I also want to point out that at any point during our discussion today, you can also enter questions in the Q&A field, which you also see as a separate tab, again, below the webcast window. Okay, please take a moment to complete the poll. Can we start sharing the results? Okay. I can see a lot of you are still filling it out, so thank you for that. Are we able to see the results now? All right. Well, I am seeing that many of you are concerned with some of the key issues that obviously animate and motivate this entire workshop. So the sort of most common response I'm seeing is that folks on the webcast are concerned about the underinvestment in the social determinants of health. Which clearly is a reason why we're having this conversation, because we want to understand what will it take so that the broader public and policymakers alike understand how we can get to a better investment or a more balanced investment in social services. I also see that you are coming here because you're concerned with the overall high healthcare expenditures of our system, which makes a lot of sense given what we focused on yesterday in the workshop. Some of you are also obviously concerned about the underfunding of the public health system, which has created enormous challenges in COVID response. And racial health inequities are also driving your interest today. I think this is great because this is the context that each of our panelists are going to discuss from their own work, understanding what it is that the general public and policymakers consider the most important policy issues.